One man, one swallowed knife, one bold decision that changed everything. In the 17th century, a time when medicine was a blend of superstition and rare insights, lived Andreas Grünhyde. He was a surgeon practicing in a world where any intervention into the human body was considered either a miracle or madness. He faced the impossible. A patient had swallowed a knife. Grünheide did not flinch. He did what no one had done before him. He opened the stomach. He extracted the blade. He saved a life. Through this act, he didn't just perform a miracle. He became the father of a new era. He laid the foundation for the first clinical hospital in history, where knowledge was born from observation, not from ancient texts. But let's set aside the romance of instant epiphanies. Great discoveries rarely emerge as a sudden flash of genius. They are not the burst of a solitary thought. Rather, they are the result of persistent effort, a series of errors, countless attempts, and most importantly, a willingness to challenge established norms. Stem from a confrontation with reality that doesn't fit into conventional frameworks. This was precisely the daily reality for 17th century medicine. In those years, the human body remained an enigma. Its internal workings were understood through the prism of ancient dogmas. Medicine relied not on empirical experience, but on doctrines forged a millennium and a half earlier. The works of ancient Greeks and Romans, such as Galen and Hippocrates, rewritten and reinterpreted countless times, became an absolute, unquestionable truth. These antiquated tomes dictated every decision, every method, every touch to the ailing body. Illness was attributed to an imbalance of the four bodily humors: hot blood, acrid yellow bile, melancholic black bile, and cold phlegm. Or just as frequently, it was seen as a manifestation of divine wrath, evil spells, or curses. Treatment. Bloodletting remained the universal answer for any ailment, from fever to fractures. Thousands of leeches, razor incisions, opened veins bleeding profusely, all were attempts to restore this supposed balance. Emetics and powerful laxatives purged the body of harmful humors, often leading patients to complete exhaustion. People suffered, their strength drained, yet these practices, sanctified by tradition, persisted for centuries. No authority questioned them, for so it was written in the books. Surgery teetered on the brink of craft and barbaric torture. It was not performed by learned, trained minds, but by barbers, butchers, itinerant bone setters, and quacks. They wielded a set of crude instruments: saws, forceps, knives, yet their anatomical knowledge was primitive, and their understanding of hygiene non-existent. Wounds? They were not disinfected. Instead, they were cauterized with red-hot iron, or doused with boiling oil, tar, or sometimes wine, to staunch bleeding and prevent what they mistakenly believed to be putrefaction. The pain was unbearable, and the screams of patients echoed far. Death remained a frequent, almost inevitable guest after any serious intervention. Pus oozing from wounds was not considered a sign of deadly infection, but rather a laudable phenomenon. It supposedly indicated that the body was successfully fighting the ailment, purifying itself of impurities. Doctors even actively promoted its appearance by introducing irritating, sometimes poisonous, substances into wounds. In this world, where unbearable pain was an inevitable companion to healing, and ignorance was skillfully disguised as unquestionable authority, every attempt at medical treatment became a deadly lottery. Each patient was a target for methods that today seem savage and barbaric. Medical treatises did not encourage observation or demand empirical evidence. They merely prescribed. They forbade. And they held knowledge in chains, shackling any progress, any new thought. It was a world where survival depended more on blind luck than on the true skill of the healer. Andreas Grünhyde was no stranger to this world of pain. Born in Hanover at the end of the 16th century, into a family not directly connected to medicine, his path nonetheless led him there. He received an education available to few, studying Latin and ancient works, the very antiquated tomes that dictated every step of a physician. He learned anatomy, not through dissections, but from old engravings. He was taught to believe in Galen, to believe in Hippocrates, to believe in the balance of bodily humors. Young Grünheide began his practice in one of the public hospitals, not in luxurious wards for the nobility, but among common people where illness was not hidden behind screens. Here there was no room for theories, only reality, a daily, harsh reality. He witnessed how bloodletting did not save from fever, but merely debilitated. He saw how emetics did not expel illness, but led to exhaustion. He observed how wounds, doused with boiling oil, did not heal, but festered. He saw how pain became a constant companion for every patient. The pus, which his colleagues considered a laudable sign of purification, was for Grünheide a harbinger of death. He watched patients slowly fade away, despite all efforts prescribed by ancient authorities. Dozens, hundreds of deaths, one after another. And each time, the books were silent. They offered no answers. They merely prescribed a path to demise. Over time, his faith in the dogmas began to wane. Not overnight. It was a long, agonizing process. Each new day in the hospital, each new patient, each new failure of traditional methods, all chipped away at his convictions. He began to ask questions, not aloud at first, to himself. Why? Why so much suffering? Why did the prescribed treatment only exacerbate the pain? Why did the knowledge they were taught not work in practice? This experience became for Grünheide not just a job, but a battlefield. A battle between inherited dogma and observed reality. A battle that planted seeds of doubt within him. Seeds that would one day sprout into a new, unprecedented form of medicine. But for this, a catalyst was needed. Something that would compel him to act against everything written in the books. Andreas Grünhyde, accustomed to trusting only his own eyes, made his first radical departure from dogma not with the swallowed knife, but with an ordinary wound. In one of the hospitals where he practiced, a patient arrived with a deep cut requiring immediate treatment. Traditionally, the wound was to be thoroughly doused with boiling oil to cleanse it and halt supposed putrefaction. But on that day, by chance, the supply of oil had run out. Not a single drop remained. Authoritative texts offered no alternatives. The patient lay bleeding, and Grünheide stared at the empty shelves where the oil vials usually stood. It was a dead end, or perhaps a chance. He remembered hundreds of patients whose wounds, treated with hot oil, had not healed, but only inflamed, becoming covered in laudable pus. He had seen their suffering. He had heard their cries, and he knew. This pus was a path to death. In a moment of insight, Grünheide made a decision. He took clean water and several pieces of cloth. Instead of burning the flesh, he carefully washed the wound. Then he applied a simple clean dressing. No fire, no boiling oil, no poisonous poultices, just cleanliness and rest. The result was unexpected and compelling. The wound healed. Slowly but surely. Without the abundant pus that was considered normal, without the fever that usually accompanied purification. The patient recovered. This was not mysticism, but logic. Simple, empirical logic, sorely lacking in medicine. Grünheide repeated this method again and again. With each new healed wound, his conviction grew stronger. Cleanliness, not fire, was the true healer. This discovery, quiet and inconspicuous amidst great achievements, was the first yet decisive step. It gave him the courage to trust his own eyes, not ancient scrolls. This newfound confidence was soon put to its most severe test. One day, a man was brought to the hospital in a horrific state. He had swallowed a knife. Not a small kitchen knife, but a long, sharp blade meant for butchering meat. It was lodged deep inside, tearing his internal organs. The patient writhed in agony, his face pale, his breathing becoming shallow. Death was only a matter of hours. Grünheide's colleagues threw up their hands in despair. The books were silent. No ancient treatise, no authoritative work described such a case. There were no prescriptions, no methods. The patient was doomed. They prepared him for death, offering solace with words about divine providence. But Grünheide could not accept it. He saw this man. He saw his suffering. He remembered his doubts, his observations. He remembered how clean water had saved lives where boiling oil killed. And then, amidst this hopelessness, a thought was born. A mad, unthinkable idea for that time. To open the stomach. To retrieve the knife. This was unprecedented. Internal organs were considered sacred, inviolable. Any intervention meant certain death from infection or bleeding. But the patient was already dying. There was nothing to lose. Grünheide made his decision. He prepared his instruments. A sharp scalpel, forceps, threads. His hands were steady. First, he made an incision in the abdominal cavity, guided by his meager but empirically tested knowledge of anatomy. Then, with extreme caution, he reached the stomach. The sharp edge of the knife was palpable through the organ's wall. Another incision. Blood gushed. Grünheide acted swiftly. He inserted the forceps, located the handle. Seconds felt like an eternity. Then, with superhuman care, he extracted the blade. Long and bloodied, it now lay on the operating table. The patient's heart was still beating. Now came the most critical part, to sew. Grünheide meticulously stitched the edges of the wound on the stomach, and then the edges of the abdominal cavity. He used no purifying mixtures, only clean needles, clean threads. And, as he had already done with ordinary wounds, he applied clean, moist dressings. The days following the operation were agonizing. Everyone expected death. Colleagues predicted a swift demise, condemning his audacity. But the patient survived. Slowly, with immense difficulty, he began to recover. His fever subsided. Pus did not appear in laudable quantities. The wound healed. Several weeks passed. The man who had swallowed the knife stood on his feet. He was alive. This was not merely a success, it was a challenge to everything they knew and believed. Grünheide didn't just save a life, he proved that the body could be operated on. That intervention was possible. That lives could be saved. This was the first successful gastrotomy, the opening of the stomach, in the history. And it was performed not thanks to ancient books, but in defiance of them. This incredible act was not just the pinnacle of his personal experience. It became a turning point that forever changed his life and, ultimately, defined the trajectory of medical development. He showed that true knowledge is born not from dogmas, but from bold action and keen observation. The success of the gastrotomy was resounding. But for Andreas Grünhyde, it was not the end of a journey, but merely the beginning. He had saved a life, and this was just the first proof. Proof that his own eyes saw more accurately than ancient books. This single, incredible case forced him to rethink his entire practice. He simply could not return to bloodletting and boiling oil. He had seen the results. He knew it was no accident. His mind worked differently now. He no longer sought confirmation in antiquated tomes. He sought patterns in reality. If clean water and simple dressing saved a wound, and a gastrotomy performed with cleanliness and precision saved a life, then these principles were universal. It meant the body did not purify itself with pus. It meant pain was not a sign of healing. This was not mere intuition. It was empiricism in its purest form. Observation, hypothesis, verification. And then, observation again. Grünheide began to systematize his knowledge. He didn't just treat, he studied. He documented every case, every wound, every operation. He recorded how the body reacted to his methods, what worked, what didn't. He learned from every mistake, every complication, not attributing them to divine providence or evil spells, but analyzing their causes. If a wound didn't heal, he didn't revert to old methods. He sought new approaches, perhaps a different dressing, a different suture. He constantly refined his technique, demanding unprecedented cleanliness from himself and his assistants. Instruments? They had to be more than just sharp. They had to be sterile. The word wasn't known then, but he understood the essence. Dirt kills. He effectively invented a new approach to using surgical instruments, requiring their thorough cleaning, not just wiping. But knowledge confined to one person's mind could not change the world. Grünheide understood this. He saw his colleagues continue to harm patients by adhering to dead dogmas. He needed to share his discovery. But how? All scientific works were written in Latin. It was the language of the elite, of universities, a language inaccessible to most practicing physicians, barbers, and bone setters. And so, Grünheide made another bold decision. He began to write. To write about his observations, about his methods, about the lives he saved. And he wrote not in Latin. He wrote in German, in his native language. This was a revolutionary step. It was an act of democratizing knowledge. His works could be read not only by learned scholars, but by any literate practitioner, anyone who held a scalpel or a leech. This was a direct challenge to authority. He bypassed them, addressing directly those who daily confronted the reality of illness and death. In his publications, he meticulously described not only the gastrotomy itself, but also his principles of wound care. He demonstrated that pus was a sign of illness, not healing. He advocated for cleanliness over cauterization. He called for observation, not blind faith. He didn't just share a success story. He proposed a new philosophy of medicine, a philosophy based on evidence, not ancient myths. This was more than just the dissemination of information. It was the creation of a new technology of influence, direct, accessible, empirically proven knowledge. His books became a kind of living textbook, not a dead one. They taught not quotations, but action. Thus, step by step, by reflecting on each move and sharing it with the world, Andreas Grünhyde paved the way for a new era of healing. He didn't just operate. He retaught the world how to look at humans and their bodies. Andreas Grünheide's books, written in plain German, did more than just disseminate knowledge. They became a shockwave that crashed against the granite monolith of the medical establishment. University professors, members of medical guilds, influential physicians who had lived for decades by Galen's precepts could not accept the obvious. The man who saved a patient with a swallowed knife, the man who washed wounds with clean water instead of boiling oil, was no hero to them. He was a heretic. Their fury was boundless. Charlatan, ignoramus, a barber who fancies himself Asclepius. Such accusations rained down from all sides. How dared this Grünheide claim that pus was not laudable purification, but a sign of deadly infection? How dared he declare that the body could be opened, that internal organs were not sacred and inviolable? This contradicted everything they had been taught. It refuted every line written in their Latin folios. Their main argument? It's not written in the books. Ancient works were their Bible, their law, their sole source of truth. Grünheide, with his festering wounds that he called sick and his stitched stomachs, was a living refutation of their world order. They branded his methods as barbarism, an assault on divine order. They claimed his patients survived only by sheer luck or through devilish intervention. They saw him as a threat not only to their reputation, but to the very foundation upon which their power and authority rested. Persecution began. Attempts were made to ban his books. He was accused of witchcraft and sacrilege. Medical councils demanded that his license be revoked, that he be expelled from the profession. They predicted shame, poverty, and oblivion for him. They tried to block his access to patients and hospitals. The entire machinery of traditional medicine bore down on him, striving to obliterate any memory of his audacious experiments. But Grünheide did not waver. His answer was not words, but living people. People who should have died but survived. People whose wounds had healed without agonizing pus. He presented his patients to them, he showed them his records, his evidence was tangible. They walked, they breathed, they lived. And this was the most powerful counterargument. It was these living proofs that attracted attention. Not from everyone, of course, but from some. Influential, far-sighted individuals not tied to the dogmas of medical schools. High-ranking officials, aristocrats, even representatives of royal courts, who needed results, not quotations from Galen. They witnessed how traditional doctors were powerless in the face of epidemics and simple injuries. They saw their loved ones dying despite all the bloodletting and cauterization. These individuals, disillusioned by the impotence of orthodox medicine, became Grünheide's patrons. They didn't just take his word for it, they invited him to their sick. They observed, and they saw how the man branded a charlatan performed the impossible. They provided him protection from attacks and funding for further research. They understood that before them was not just a talented physician, but a harbinger of a new era. This was not blind faith, but pragmatic calculation. They protected him not out of whim, but because his methods worked. And this protection allowed Andreas Grünhyde to continue his path, despite the fierce resistance from those